Hi everyone, thank you so much for joining this VIMTalks webinar, where we will explore a healthcare technology solution called CareMessage. CareMessage has been a partner of the VIM network for a little over a year now, and in that time has started working with a number of volunteers in medicine clinics. These clinics, many of whom attended a similar webinar last year, have seen great results from CareMessage's technology and have shown the important impact and relationship clinics can have with their patients by communicating with them through text. But before I dive into talking about their success, I always like to start with a little background information on CareMessage. We are a nonprofit organization based in San Francisco, and we have developed an online tool to help support patient engagement at your clinic. Our solution enables healthcare providers such as yourselves to communicate with and collect data from patients using mobile technology. Today, we're working with over 100 organizations across the US, including hospitals, health systems, federally qualified health centers, free clinics, and a range of others. And the feedback we've received across the board is that this is a tool that makes engaging with patients much more streamlined, interactive, and in many cases helps patients feel more cared for in those weeks, months, or even years between appointments. Interested customers often ask us, how do I know my patient's text message? Today, there's a lot of research out there that not only tells us the ubiquity of cell phone use, but also the high proportion of people using text messaging. We've done some studies on mobile usage, and what we found is that even in clinics that serve up to 25% homeless patients, we see approximately 80% of those patients on unlimited text message usage plans. Additionally, there are resources like Lifeline, TracFone Wireless, and Insurance Wireless, which have free phone plans that include unlimited text messaging. These are typically available for patients seen in the free and charitable clinic space. So how does CareMessage work? While we won't be walking through a live demo today, I do want to show everyone this slide to help frame how you might interact with the system. Providers log into CareMessage and are then able to send messages directly to patients' cell phones and landlines, all while the CareMessage system captures that data and builds reports for you. The types of messaging you can send with CareMessage embodies three main styles. First is appointment reminders. Appointment reminders are customizable messages that you can send to patients that remind them of the date and time of their appointment, ask them to RSVP yes or no if they will be attending their appointment, and provide other information about forms or medications they might need to bring. Our partners using appointment reminders have seen a reduction in their no-show rate by 6 to 20%. A common question I get with appointment reminders is, well, is this automated? We do have system integrations built with a number of EMRs and population health tools. Those include DataNet Med Services, Eye2Eye Tracks, and MD Rhythm. Now, if you're using a different EMR or are using paper, rest assured, 80% of our free and charitable clinic partners use CareMessage effectively without an integration. The second tool is outreach and surveys. This tool is for messaging a subset of your patient population and even collecting data back from them on a one-time or automated basis. Examples include appointment recalls, preventive screenings, letting people know about services at the clinic like flu shots, prescription pickup or refill reminders, or even case management follow-ups. Group outreach messaging can also be useful in cases of closure when you need to alert your entire patient population that a site will be closed. One sort of success story we just had with outreach, we had a partner send a mammogram reminder to over 400 of her female patients, and with the outreach tool was able to fill 100% of those screening appointments, streamlining her efforts. The last tool that CareMessage has available to our partners is our health education programs. Our research team has developed 13 interactive and automated programs that cover a range of disease management efforts, from chronic diseases to behavioral health to general wellness. These programs automatically deliver 3 to 5 messages a week to participating patients. And these messages range from being interactive questions relating to healthy behaviors or knowledge to healthy tips, recipes, and advice. We recently did a study with the National Institute of Health and a partner here in San Francisco who enrolled patients in a combined chronic disease program. And at the end, those patients that had finished the program, 94% felt that they had learned to better manage their condition due to the messages they were receiving. Now, a big focus of CareMessage is making sure that the messaging is helping our patients. Our user experience team here at CareMessage has done multiple interviews with patients seen by our partners and gotten great feedback relating to their experience. You can see some of those testimonials here. I'd now like to highlight 3 of our Volunteers in Medicine partners, starting with Center Volunteers in Medicine. Center Volunteers in Medicine has been using CareMessage for around a year and a half, predominantly using our survey tool to collect and report on patient satisfaction following visits at their dental clinic. Prior to implementing CareMessage, Center Volunteers in Medicine had a challenging time collecting this feedback from patients who, following dental surgeries, could not physically describe their experience. Now, with the text message solution, immediately following their visit, Center Volunteers in Medicine staff is able to send patients the questionnaire and review the data collected within CareMessage. Additionally, in the coming month, Center will be expanding their use cases into appointment reminders as well as some additional outreach messaging. I also would like to highlight Free Medical Clinic of Oak Ridge. They're currently using CareMessage for the purposes of appointment reminders and wellness class messaging. Teresa Britton, the executive director there, started using CareMessage a little over a year ago and to date has sent over 2,000 appointment reminders and has seen some really exciting outcomes. Since implementing CareMessage, Teresa has seen a 15% reduction in their no-show rate and a 30% increase in wellness class attendance. Last but not least, I want to feature Volunteers in Medicine Hilton Head. Cindy Johnson and Raymond Cox have been using CareMessage's health education programs at VIM Hilton Head to help their patients learn more about nutrition, exercise, and tobacco cessation. Complemented by regular outreach messaging, they are seeing incredibly high engagement with the messaging and lots of exciting outcomes. Following the completion of the exercise program, 80% of Hilton Head patients felt that they were exercising better after completing that program. Now, before we close, I want to spend some time going over the standard implementation process for CareMessage. Typically, partners are up and running on CareMessage in around 4 to 8 weeks. Now, this timeline can depend on a number of things, those being staff availability, complexity of use cases, and technical infrastructure. It's throughout this process that your team and your dedicated account manager here at CareMessage will set goals, define workflows, and build processes to make CareMessage a seamless fit into your clinic environment. It's also during this time that your account manager works with your team on how to approach patient consent. While CareMessage is a HIPAA-compliant platform, text messaging is not a secure form of communication, meaning anyone could pick up your phone and read the text message. For partners that are interested in learning more about consent, we have collected guidelines from a number of government bodies that can help your team find the approach you and your patients are most comfortable with. Now, if this video has inspired a question or concern, please feel free to reach out to Hannah Rapp, the free clinic account manager at CareMessage at hrapp@caremessage.org. Thank you so much to the Volunteers in Medicine Network for hosting this webinar.